If you're listening to this episode on the day of release, Tuesday, October 10th, 2023, you might be listening while I'm flying through the air in an airplane to El Salvador. And though El Salvador is a beautiful, magnificent place, this trip is not for vacation. A few months ago, I came across a nonprofit organization online called Extra Mile Pediatrics, an organization whose niche and mission is to provide repeated pediatric care to communities that face significant barriers to receiving treatment. Communities in places like El Salvador and Guatemala. And for the next 7 days, I get the honor of experiencing the life-changing work of Extra Mile Pediatrics in 5 different communities of El Salvador. So if you want to follow along with me, make sure to follow me on Instagram at hetal.baman, that's HETAL.BAMAN, and my LinkedIn page, where I'll be posting updates, insights, and experiences in real time. I'll also post those social links in the description below. This trip is special to me, not just because I get to tap back into my passion for service, and not just because I get to experience a new place and new people, but because the team at Extra Mile Pediatrics have chosen to put their trust in me to share their story by sponsoring this trip, as well as some episodes of this podcast. So to say that I'm honored is truly an understatement. So thank you so much to the team at Extra Mile Pediatrics. This episode kicks off the week in El Salvador, and it features Dr. Jeff Mapp, co-founder of Extra Mile Pediatrics. He shares snapshots of his life and the stories of how he first got attracted to the world of medicine and later to the world of pediatrics through an extreme culture shock. His first international trip to help a group of pediatric neurosurgeons serve the children of Guatemala. Since then, he knew that the universe would lead him down the path of serving children in areas of the world where healthcare is the least accessible. Before we dive in, here's a little bit about Dr. Jeff Mapp. From Richmond, Virginia originally, Dr. Mapp graduated medical school and completed his pediatric residency training in Richmond at Virginia Commonwealth University School of Medicine. Dr. Mapp has always had a passion for global health since being introduced as a volunteer with a global health group in Guatemala as an undergraduate in the late 90s. He then continued to volunteer with various global health organizations after residency until after completing an MBA at UNC Chapel Hill in 2015. He then continued to volunteer with various global health organizations after residency. And after completing an MBA at UNC Chapel Hill in 2015, he began creating Extra Mile Pediatrics, and it was launched in 2018. Dr. Mapp continues to serve as the executive director of Extra Mile Pediatrics, as well as on the faculty at the Children's Hospital of Richmond at Virginia Commonwealth University as an assistant professor in pediatrics. My name is Hetal Baman, and this is the Global Health Pursuit. I'm very excited today because today I get to interview Dr. Jeff Mapp. I'm going to call him Jeff because he gave me the permission to call him Jeff. And it's going to be a really, really fun conversation. He is the founder of Extra Mile Pediatrics, and I am doubly excited because I'm going to be experiencing what they do in El Salvador just next month. Yeah, it's September 20th, the date that we're recording it, and just in a few weeks. I'm so excited. Thank you for coming on.
Yes, no, thank you for having me. I'm super excited to talk about this as well. And we are also really pumped to have you on board. So yeah, we're like 3 weeks away from our trip to El Salvador that you're going to join us for. So yeah, awesome.
First things first, I really just want to ask you about yourself, your story, you know, what your educational background is, And what sparked your passion in pediatrics?
Sure. Yeah, interestingly, the story of what got me into, got me excited about medicine as a career is also very much the same story that got me interested in global health. They both kind of have at least launched from the same place. So I'm from Richmond, Virginia. I'm the oldest of three boys. When
That
I
must
was
have been fun growing up.
yeah, it was a fun household. My mom has a picture in her bathroom that says there's a special place in heaven for the mother of three boys, and I think we
Mm.
definitely made her appreciate that role. So I was the first to leave home for college, and basically at that exact point in time, I went to school not knowing exactly what I wanted to do with myself,
Mm.
just interested in being a college student, and kind of I went to a liberal arts school, and my plan was to go. I had a few things I liked, but I didn't know where, what my path was. Within a couple of weeks of being gone, my parents contacted me. My youngest brother, who's about 9 years younger than I am, had some difficulties with seizures over the 6 or 12 months, or maybe a little bit longer, before I left to go to school. And so his process in terms of the workup of that and the treatment of that was ongoing. And right after I had left to go to school, my parents contacted me and said, your brother had an MRI and it actually showed a brain tumor.
Wow.
And so obviously, that's crazy and scary and unsettling and all the things at any point. But, for someone who's just left to go to school and you're away from your family for the first time and all those things, it just rocked all of us, obviously. But very shortly after that, I don't know how many days, but it was days after that, they called me again. And I just remember that conversation. I'll never forget that conversation, because my mom just said, we met with the neurosurgeon and it's all going to be good. And I'm like, tell me about
Mm.
that. And she's like, I just had this overwhelming confidence and peace that this surgeon that we met had it under control. And really, I think from that moment, I appreciated that as a physician, he understood that he was treating my brother, but he was really treating our whole family. And he,
Right.
the way he cared for, all the angst and all of that was not just his patient, but the group around him was just phenomenal. And then he had surgery. It was very successful. My brother is still doing great. He's a father of three. But looking back on that process was like, okay, this is what I want to do with my life. This is just unbelievable. And that grabbed me. And especially at that moment in life, being 18, being a freshman in college, it was just the right thing at the right time. So
Wow.
the interesting tie into global health is, my family, we don't have anyone in medicine in my family. My mom's a teacher. My dad's at the time was in banking. And so, my mom, at a follow up with my brother with that same physician, said, hey, Jeff wants to go to medical school now because of you. Do you have any,
Oh, that's so
she said,
funny.
do you have any
Oh.
suggestions for him? And he said, well, does he speak Spanish? And my mom, being a great mom, was like, he speaks great Spanish, which was definitely
Did you take
probably.
like two
I
semesters
was,
of
yeah, I was
Spanish
like
in
in
high
Spanish
school?
2 or 3 at the time, and I could barely ask, where the directions to the restroom or whatever.
Right.
So anyway, he said, why don't you send them with me? I go to Guatemala. I take groups of residents, to Guatemala to do neurosurgical missions and all those kind of things. And so, my mom calls me at school and says, great work, great news. I signed you up to be an interpreter on a
Oh
neurosurgical
my
mission in Guatemala.
gosh.
And I went, oh, I'm like, first, thank you. That's amazing that you,
Yeah.
but second, oh my gosh, I'm just nowhere near equipped. I mean, anyway, but I went, I dove in, and certainly they didn't end up really using me as an interpreter. I went and I just was an
Right.
extra set of hands. Right. And I went with no medical experience at all and just was excited to help. I would carry boxes. I would, hold patients. I would, whatever the case may be, whatever the team needed me to do, I just jumped in and kind of helped where I could. But the interesting piece is that allowed me to, my very first exposure to the practice of medicine, to that side of things, was in Guatemala, in a place where, many of our patients had traveled hours, if not days, just to get to that clinic.
Right.
And the resources and the access and all, that was my very first exposure to medicine. And so everything that then came after that, medical school, residency, all of those things, I've always, seen medicine here in the States through this lens of, the reality of what's out there. And so I think that, that obviously had something to do with the start of just a career in medicine, but it very clearly also had something to do with me always wanting to get back to serving in those areas and with those populations, because just the awareness was always there as far as resources and access and all that kind of thing, depending on where you're born.
That is such, I think, a valuable experience. I don't think my parents would have, even if I said I wanted to go back to India, like my parents would be like, heck no, not at that age. Like, it's very dangerous, all of that. I don't think I went on my first service trip or even like experienced India until experienced the poverty side of India. I don't know, until I was maybe like 25.
Right. Right.
And that, I have these stories that my dad would tell me where he would sleep on the sidewalk because they had a two-room apartment, and it was with him and 7 brothers and sisters and his mom and dad, and sometimes even the grandparents were there. And just to imagine that he would sleep on the sidewalk because that was where the coolest area was. It's just interesting because you can't picture it in your mind until you're actually there.
Correct.
And you're like, oh, this is the actual situation. And now I understand why my dad can sleep wherever, because once you sleep on a cement ground.
That's right.
Right. You can sleep wherever. But I think that's so interesting. So you were a freshman then?
So it was actually the summers. I ended up going twice. I loved it. I couldn't get enough.
Yeah.
And I went the summer after my sophomore year in college, and then again the summer after my junior year in college. So the first time that you stepped onto Guatemala earth, right.
What was your first impression? Because what did you expect to see?
It's interesting, and I think that ties into your point about at that age and going, and that's a big deal. But there was a lot of, I was, naive, honestly, and I don't know that there was a lot of thought. My thought process at the time was, man, this is great. This doctor is amazing, and I get to spend time with him, and this may help me get into medical school. At the time, I think that was my mindset, right? I was doing this because
it was, your resume.
this was a resume builder. And it was also an opportunity to see, is this actually what I want to do with my life, right? It was an opportunity.
Almost at the extreme end too.
Right. So it was,
right?
So that was my mindset going in, though. I didn't spend a lot of time. I was looking at it really primarily from those two angles, right? Is this what I want to do? And this will give me a good opportunity to see that. And if I want to do this, then this will clearly potentially make my resume stand out, a little bit. And so I didn't spend a whole lot of time thinking about, the safety aspect of it, to be honest,
right.
or the poverty, or where we're going to stay, or what are the conditions going to be, all the things now that we are spending a lot of times answering answering questions with our volunteers, is it safe, and what are we going to do for food, and all of those things, which are all super important. I was a college student. I was 19, 20 years old. I wasn't thinking about that stuff.
Yeah.
And I think, that's part of the story too. I think that's part, there's a right time for all of this. And I think sometimes people feel like, what, this sounds great, but I'm not in a place where I can handle that right now. And I just was at that point, right? I was just in that place. I was young and, experimental, I was willing to take chances, and I was willing, that kind of thing. So I didn't have a lot of expectations. And I do remember I also had not really done any international travel. This was my first step out of,
wow.
your sort of shell that you grow up in. And so it just was all unbelievably, it just was mind blowing. I mean, it's just the expansion and the perspective that you immediately are thrust into. If you've spent your whole childhood growing up in, middle class America, and then you go there, it's really it's there's just no way to really put it into words.
Yeah.
It's just the whole
It's
thing
just a
is like,
culture
wow,
shock.
it's just a culture shock. Exactly. So I don't know that I had a lot of expectations. I think that probably was a good thing. Not that
Right.
it was, I mean, because I came home with nothing but positive memories, literally nothing. I didn't feel unsafe. I found the people and the places to be incredibly warm and welcoming, and I never felt unsafe. And it was a wonderful experience all the way around, and I haven't had an experience that wasn't that way since. Every time I'm there, I feel that way.
Hey there, I hope you're enjoying this episode. And if you are, would you do me a tiny favor? Show me some love by doing one or more of these three things. A, click the support this podcast link in the description to donate a few dollars toward the production of this podcast. My dream is to do this full time, and your support would mean the world. B, you can write me a review on Apple Podcasts and or rate me on Spotify to give me a boost in the algorithm. Or C, share this episode with someone who would love it just as much as you do. I truly and deeply appreciate you. Let's get back to the episode. It's always the first service trip that you just never forget. Because I remember the same thing with me. It's when I went to India for a few weeks to work in the slum schools. And there's this little boy named Shivam who would just latch on to me. And he used to take me around. He gave me little tours of where they lived and where his friend lived. And then, his mom would make me chai. And I'm like, oh my goodness. It's just, yeah, that kind of thing just never leaves you. Okay. So you went on this trip with a neurosurgeon, right? Tell me about the neurosurgeon aspect of things in Guatemala, and then kind of pivoting to finding pediatrics and, learning about that and then pursuing that as your career.
Right. Well, importantly, this was a pediatric neurosurgical mission, so that
Okay.
there's always been a pediatric component, to what I was exposed to from the get-go. And I do think that there is a tie-in there. In Central America in particular, and I think in many places where, resource limited places, neural tube defects are just much, much, much more common, right?
And what is that?
So things like spina bifida, hydrocephalus,
Okay.
basically defects during development, kind of congenital defects that
Right.
involve the spinal column are more common, and a lot of that has to do with folate, a lot of, the lack of prenatal care, the lack of prenatal vitamins, the lack of, folate enriched foods, those kinds of things really set them up. And so I think, just with the incidents there was a huge need for that particular service. And I took away a lot from those trips that really started to impact, when we were starting to think through forming Extra Mile Pediatrics. There were pieces, even though that was a neurosurgical mission, there were pieces of the way they were doing things, the way and really the why, that really impacted how we chose to kind of set our things up. With global health kind of service work, there's always a risk, right? There's always a risk of doing more harm than good and those kind of things. And I think
Right.
you always have to think through how you set up your process and how you approach care and where to some degree, so that you're not undermining the existing health system, so that you're only supporting it, so that you're considering what's the sustainability, what are these patients, what's their access like when the team is not there, those kind of things all have to be considered. And
Right.
this was 1999, I think, the first time I was there. And so even for almost 25 years ago, I feel like the team was very good about trying to mitigate some of those. It's hard to mitigate all of them, but it was really, they did a great job of that. So, my big takeaways were the need was phenomenal the tie-in of the need to access resources, geography, all the barriers that some of these families were facing to having good, healthy, access to healthcare. So that was definitely a takeaway. I will say that, pivoting, as you said, to my eventual career path in medicine, I found that I think I've always just thought I would be in pediatrics. Even if it was a subspecialty, I always thought I'm drawn to kids. I'm very comfortable with kids. Kids are comfortable around me. It's just always been the way it is. But also going back to that origin story we talked about, I also love that family connection, right? That you're taking care of the whole family, that you're partnering with the families essentially to just be a small part in the raising of that child or those children. And I love that. And I think, I eventually found that one of my skill sets is that communication and that view of it being a partnership and that kind of rapport building and those kind of things. And so the surgical aspect became a little less important to me, and really what it was really that bond. And I think as a general pediatrician, you do get to be involved over the long term. Whereas if you are, more procedure based like a surgeon is, it's a snapshot, right? And they're involved, but it's sort of you're in there, you do what you're there for, you do some follow up, and that's it. But really, the pediatrician is the one that's going to continue to walk with that family, and that just fit me. That just fit me better. I loved what they did. I'm in awe of what neurosurgeons and pediatric neurosurgeons do, but it was really the pediatric aspect. It was really the family care, holistic approach that was attractive to me.
Growing up, that was actually a career that I was thinking about if I were to go into medical school, because I have a whole slew of cousins who are doctors in my family. So I just thought that I was going to go to medical school as well. And then obviously that didn't happen. But pediatrics was always something that I was thinking about as well, because, the children, the aspect with, working with kids was always something that attracted me as well. I want to ask you about your process in terms of founding Extra Mile Pediatrics, because as I understand, you didn't think about founding a nonprofit until way later, after that first few service trips and getting your medical degree and all of that. So kind of coming back to starting a nonprofit, what were your initial thoughts and process?
Well, you're right. There was a fairly large gap between those first few exposures as an undergrad, 19, 20 years old, and then ultimately where we are now. And I think the first portion of that time gap was really just, I was fortunate enough to get into medical school and then residency, and then, having two young children of my own, and just not feeling, again, we talked about it. Sometimes you're just not in that place where you can commit the time and the energy to this. And I wasn't for a bit, but it was always there. It was always on my heart to sort of say, this, as soon as I can, I'm getting back to this work. Yeah. And what that ended up looking like for me and for my family was somewhere in the 6 to 7 years after residency. My kids had grown a little bit. We'd sort of established, I'd worked long enough that I'd built up some time off, and, those kind of things, all those factors lined up. And I started just jumping back in, knowing that I wanted this kind of work. I started jumping back in with organizations that were already in existence and doing global health work. And so I had the opportunity to go with a couple of different groups to Nicaragua, and I went to Africa, and just sort of, I always would come home from those trips absolutely fulfilled. I would feel, there was a ton of purpose in what we were doing, and I loved it. And I loved those organizations. I still do. But I also would come home with this little pull to say, man, I wish we could just have changed this aspect of this, or this, that kind of thought process was always like, I want to just change this, but it wasn't my organization. And so, those kind of thoughts were sort of, I was almost like creating a little bit of a list of, if this were me, this is how I would do this differently. And then for very different reasons, in 2013, I went back to school. I had been in private practice general pediatrician and sort of, part owner of a private group. And we, as a group, decided that we really needed to have some financial leadership, just given the way market pressures were going in medicine and all those things. So I went to business school and went and got an MBA at UNC Chapel Hill, and that was 2013 to 2015. And that really was pivotal. I certainly went with the thought process and the understanding that this was just to help run a business. It really,
Right.
I wasn't thinking of it in terms of global health work, but very shortly thereafter, after finishing that work, I was back in Nicaragua again. And this time, actually, I was with my wife. My wife's a pediatric nurse, and we were serving together on this team. And every night we would come home from clinic and she had to listen to me talk about, man, we just need to switch this. And wouldn't it be cool if we could do this? And by the end of the week, it was, and having just finished that business education where if you have a, quote unquote disruptive thought, if you have something that's different, if you have a model that's, then you just do it, right? And so I came home from that trip, and the combination of those pieces is really what led to Extra Mile Pediatrics. It was having this ongoing list of ways I would do things a little bit differently, and then having really the maybe skill set or education or just exposure to a thought process, really, in terms of, the business aspect of it. And everything pointed towards, I think we're supposed to start something on, and so my wife and I just got back to the States and got to work. We just first started saying, here's how we would structure it in an ideal world. And then let's go make sure that's not already out there. Because if it's out there already,
Right.
we want to support that. And that's always
Right.
our mindset. If someone's already doing it this way, let's just jump on board and do what we can to support them. And we felt like it wasn't really. I mean, there's and with global health work, it's tough because there's a lot of small groups that are just doing very grassrootsy thing. And so there may be folks doing it this way, but it really wasn't obvious. And my thought process was, let's just get it started. Let's just go and build and see what comes of it.
Yeah, that was actually going to be another question I was going to ask as to, why start Extra Mile Pediatrics as opposed to do just jump on board with another nonprofit, and that totally answered my question. I think that even if you do find other small grassroots, organizations, there's always an opportunity to partner as
Absolutely,
well.
for sure. As opposed to in lots of the business world, right? This isn't a competition thing. There's need
Right.
everywhere, right? And so this isn't like, oh, we've got to get to market with this disruptive thought. So that's why I said, quote unquote disruptive. It's really not that. It's we're not trying to compete. We're just trying to say, hey, we're going to start doing this, and the more resources we can bring to an organization and the more infrastructure we can build, just the more service we're going to be able to take on, the more areas we're going to be able to serve. And so whatever that looks like. And I think most people working in this space have that mindset. And so it's not a competitive environment. It's like, oh, that's cool the way you're doing it. We're going to do it a little bit this way, and let's see if we can work together. And, there's a lot of collaboration, and it's wonderful.
Yeah. That's the one difference between nonprofit and for-profit.
Right.
For sure. Yeah. So you were talking about, forming this unique model for Extra Mile Pediatrics. Talk about your first few trips as a nonprofit and kind of tweaking that model.
Well, our thought process was there's a lot of groups out there that will intermittently be visiting and areas to serve, areas of need.
Right.
And many of them are going and serving large numbers of patients and doing a lot of good. But what we found, and so going to that trip that we were part of in Nicaragua was, I was there as a group of physicians and nurses and those kind of things. I was the only pediatrician there. Mm-hmm. And one thing that really struck me, I think there were 7 of us providers. And so it was, myself as a pediatrician, then a bunch of adult providers, so internists, we had some subspecialists and all those kind of things, and they were all phenomenal. But, when you go into these areas where folks don't really have good access to healthcare, they're going to come to clinic whether they have an acute issue or not. They're going to, they're going to come and say, like, I just want to get checked out. And if you have children, you're going to bring your kids, right? If you're a mom or a dad in those areas, and all of a sudden there's an access to a physician, as parents, you go, well,
they're just going to put them on their back.
My kids first, right? And every single parent out there would say, I'd rather you see my kids than me. If there's a question,
Right.
all of us would be great, but I'd rather you see them. And the reality is, for every patient that showed up at that clinic, they would have one, two, three, four children with them. And all of the
And you
adult,
got overloaded.
all of my adult counterparts, especially the younger the child and the smaller the child, would sort of see them come in through the triage area, and then they would look and say, "Where's Jeff? He's got
Oh
these,
no.
these kids," which was awesome. It was phenomenal. But I mean, and don't get me wrong, just like you don't want me to be the one taking care of an 80-year-old with hypertension, like that's not my skill set, right?
Right,
I'm,
right.
give me the 3-month-old and let's talk. So what I found though is with every one of those parents that would come through, I shouldn't say everyone, but with many, many, many of those parents, they would come in and I would just say, "How can we help you today?" And one of the first comments was very often something like, "I think he's too skinny,"
Hmm.
or "He eats all the time and doesn't seem to gain weight," right? Or "Is it okay that she doesn't say very many words?" It was,
Mm-hmm.
and so we would talk through and we would, and I would explain that, it's hard to say too skinny, right? And it's really hard to say that if I'm only going to see you one time. Because what
Right,
matters to me as a pediatrician, what matters to me is not so much where are you on your growth chart, right? What matters to me
right.
is what's the rate of growth, right?
Trajectory,
How are
yeah.
you growing over time? That's going to give me so much more information. And so I found that, and that was the same with development. Are they saying enough, words for their age, or however they were articulating that question? That was at the root and what they were asking. And same thing, right? Obviously there are standards for where you should be developmentally based on your age, but I also want to know, what's your progression? Is this a static thing? Are we not gaining, or where were we 3 months ago and where will we be 6 months from now? And so I just found, you know, those issues, which are absolutely at the foundation of what pediatricians do, right? And frankly, with that's also should be at the foundation of like sustainable impact. If I'm not going to be in front of these patients all the time, let's talk about things that are going to, set them up for healthy way down the road thing. And so I came away from, and that was the case in a lot of different areas, and I came away from that saying, I really can't do this well unless I can see that family again. I would come home at night and I and
Hmm.
and we, my wife and I would be chatting, and I'm like, man, I need to see that kid again in 3 months or 6 months or whatever, and talk to that mom again, and then she'll see what I'm saying when I say like it's about over time and that kind of thing. And so at the heart of Extra Mile Pediatrics model is that we are committed to only starting those relationships with these areas if we know we can have that follow up, right? And so not every area is going to work for us at Extra Mile Pediatrics. There's going to be locations where, based on the geography, the population, is it a very, kind of migrant nomadic community, or are they really
Hmm.
all in the same place? Those kind of things. We go in and do a lot of investigation on the front end and a lot of discussion with the community leaders and all those things to say, like, what's already in place here? What kind of health access do you have? Because again, if you have good access to care, or really even decent access to care, we don't want to come in and disrupt that. We don't want to come in and
Right.
undermine that, because that's the goal. We'd rather come in and support that, or, figure out. But if you really don't have access to care, then part two would be, if we commit to continuing to come back to this exact location, do you feel it's reasonable we're going to see the same families, right? And
Right.
that's our space. That's where we work. And so that's that's at the heart of what we do. In terms of all of the communities that we're now working in, we have that kind of relationship where it checks those boxes as an area or as a community, and then we go back at least every 6 months to the exact same location, right? And working with local community leaders and local, in some cases, local nonprofits, to say, like, can you help us communicate to that community that this is the day we're going to be back there? And so we can actually answer those questions. We can say, when we first encounter that parent, we can say,
Yeah.
come back and see us. We're going to be here in January, or we're going to be here in July, or whatever that next thing. I want you to come back and let's have this discussion again. And let's talk about growth rate, and let's talk about how much we've developed over time, and let's talk about what we can do to support that.
You said that there's almost like a criteria, right? In terms of what communities would be best. So what did that look like for, how many communities are you in El Salvador?
So I usually tell people 5. Some of them are a little more
5.
loosely defined than others. There are a couple of days in a row where we use the same location, but it serves kind of communities that are all within 20 or 30 minutes in terms of for the families. And so that one, it's a little less defined. But the point is, we do 5 different clinic days, and
Right.
I think we serve about 5 different communities there.
Okay. And those communities, what did the health system look like before coming in?
So there is a public health system there, which all of the patients that we're serving, that would be there. They also have a version of a private health system in most of these areas, which essentially amounts to, if you're doing well enough financially to be able to afford it, you can access
Gotcha.
private doctors, but at a premium, right? You're paying for that
Right.
service, and the patients that we're serving aren't in that kind of a position. So they do have a public health system, and we have, in fact, the very first time we were in El Salvador to look at this area, the first place we went was the public health clinic that is sort of the service location for all of these communities. We went there first. We met with the director of that health system, who works for the Ministry of Health in El Salvador, just to say all the things we've talked about, that we don't want to come in and undermine. We'd rather work with you. How can we be of best service? Are there areas you feel like it's hard for even you to reach? We asked all of
Right.
those questions to say, like, and we found them to be incredibly warm, welcoming, and wanting to partner. They wanted our help. They welcomed it. And then together we sort of looked at, the reality that they face, which they had such great programs. They're great. The docs that we met are phenomenal, but it's underfunded a little bit. They're also under-resourced, right? And so the reality for our patients, and now that we've had we've been in El Salvador for about 5 years now, and have long-standing relationships with a lot of these families, and in those discussions, they'll say, we would go to the health clinic if something was desperately wrong, right? We did the reality of taking that day off from dad's work, or trying to find transportation, whatever that looks like, using resources to get to the clinic, which is a big undertaking. And then sitting there because that clinic is trying to serve so many patients. You don't know how long you're going to wait to be seen. And then you might be seen and they say, yes, you have a pneumonia, but unfortunately we're out of the antibiotic that you need. And they'll write it on a piece of paper and say, here's what you need to go get. And they don't have the resources to go purchase it. So,
Right.
what that ends up doing over time is it means the reality is it's really not great access. I mean, there is a theoretical access, but it's just not given the circumstances that they're facing. So that was sort of the reality for most of the patients that we have, and the reality of what everybody's struggling with to try to provide care and all of those things. And where Extra Mile Pediatrics fits in specifically is that essentially takes away the idea of like well child checks, right? You're not going to go like we do here in the States, where you take your child, at 2 months, 4 months, 6 months, 9 months, 12
Right.
months, all of those things, to say like, how are we growing, and like, what should we be doing as far as food introduction, and all of the questions that we have as parents when we take our kids to well child care are, those are all getting bypassed and sort of solved at a community level with other parents who have
Right.
gone through it, and those kind of things, which is great, and oftentimes actually a very valuable resource.
Yeah.
But it doesn't give docs that opportunity to talk about, like, well, why do we keep having these coughing fits? Maybe it's asthma, maybe it's allergies. Can we do something on a preventive level to sort of help with that? Or, let's look at this growth, and I think we need to somehow figure out ways to up calories, or, those kinds of tweaks, and they're so impactful over time, especially if you're catching them early. But that's just not a reality. That's just not, the reality is you're going to go if you really
Yeah,
have
you
to go.
kind of have to, yeah, you have to go. It's like either going to urgent care or the ER almost.
Right, right. Yeah, exactly. So that's the space we try to work in. And honestly, that's also the space where we just find that's where in this type of work, that's where the value is, right? It's because it's preventive, kind of chronic care management, longitudinal type things, and it's children. And that's the other thing about, extra mile pediatrics and why I feel as a general pediatrician, pediatricians are ideally situated to make this kind of impact, even if it's not like an ongoing brick and mortar clinic that's staffed every
Hmm.
single day. If you can get there and do that kind of care, not just get down and treat a cough that's happening right that moment, or if you can do that kind of care, it is sustainable impact, and you've got this kind of over time trajectory, kind of course changing stuff. It's really, it's. I think we're ideally
Wow,
positioned to do this.
that's amazing. The other question I had was in terms of documentation, because I'm sure that you see a ton of kids every time you go down there. How do you keep track of, each kid and their symptoms? And even with the story that you told about, is my child speaking enough or is he
Right,
growing enough? Talk about keeping track of each kid.
right. Well, that's definitely something that's evolved over the 5 years that we've been doing this, which has been kind of fun to be a part of as well. I mean, it's definitely one of our biggest challenges, but it's been fun as well. At the at the outset, it was as simple as us creating essentially a paper chart
Yeah,
system. We would document on a paper chart. We would collect enough demographic information as the patient came in that we could then identify it at a subsequent visit, and then we would fill in exam findings and all that. But to your point, we need to watch development on this child, or we need to really focus on growth rate at our next visit, or whatever the case may be. And we would
right.
transport these papers with us and essentially match them at a subsequent visit. We'd match them up. Hey, have you been to our clinic before? And that's actually easier than it sounds, because these communities are not huge, and there's a lot of recognition right off the bat of, oh,
Right.
I remember you from last time. And then we find the chart, and then let's talk about, and we have their height and their weight and whatever at the last time, and we have them today, 6 months later. And we've, like, again, at the onset, we're using, like, our growth charts were just laminated growth charts, and we had dry
Right.
erase markers, and we're drawing out their growth rates and showing them to parents. And that's evolved. We've been incredibly fortunate to have some volunteers from the Bay Area in California that have jumped on board and been just super pivotal for us. And one of them is a fantastic IT person, and we've kind of developed an electronic medical record,
Oh, wow.
so that we can do all this digitally, which is huge. Now, electronic medical records, probably overstating it. It is very much just a digital version of that initial paper, but we have there's growth charts, and it will plot these children over time, and we have, like, legitimate, World Health Organization growth chart data on these kids. So it's become a lot easier, and I think that's going to lend itself to a lot of great information and about trends and things that we can make more impact on as we go.
Yeah, I think, having everything in a digital format, it just makes everything so much easier.
Well, it
It's
ends up being a
awesome.
it ends up being a huge cost saver too, because
Right.
after a certain point in time, we had file expandable file folders that were taking up entire suitcases. So that's, yeah, that that had to go.
Oh my gosh. So how many kids would you say on average you'd see every trip?
We see almost always we see between 300 and 350 kids in a week. So
Wow.
over 5 to 6 clinic days, we've almost never been outside of that range. I think the most we've ever seen was 344, and then maybe the fewest. I think we had one trip where we saw about 288, 290. Yeah, it's very predictable, and a lot of that's driven by, again, when we're going in on the front end and looking at these communities, we don't want to be a group that shows up and say, oh, we can only see this number, and the rest of you, I'm sorry.
Right.
And so it does end up impacting what we do with how big the communities are or how much time we devote. If it's a bigger community, we'll go there several days in a row, right? And so make sure, because I think it sets you up if you're only able to see some, that then the way you prioritize that, it gets a little messy, and it doesn't
Right.
fit our model. Our model is we want to see you even if you're not sick, even if there's not something acute, because there's so much value in that development, growth, nutrition, reassurance for answering mom questions, dad questions, those kind of things. And so there's so much value in that that we don't want to prioritize by who's got a complaint and who's sick. We want to just say, let's see you.
Right. Now, okay, so this is an interesting thought that I had. I think in the beginning of our conversation, you were saying that when you would go on these other service trips that would serve like the entire family, and then they would bring their kids. Do you ever have patients that come in and say, I know that this is like a pediatric clinic, but I also need help as an adult? How do you navigate that?
So so that, yes, that happens, and it's tricky because, again, really think there's a really good way to do global health, and then there's a dangerous way to do global health. And I think going in and trying to do something outside of your scope is not the best. And at the end of the day, you're better off being honest from the get-go and saying, this is not, let me help plug you in. Let me see what resources we can help get you to, but
Right.
it's not me. I'm a pediatrician. Now, we've had some trips. Our volunteers are generally have pediatric backgrounds, but we do sometimes have a family practitioner. We've had some family practice nurse practitioners. We've had an ER doc once or twice. And so if that's in their skill set, that's the first thing I'll do is ask, like, are you comfortable seeing this patient? We may not have what we need because, of course, our medicines that we're bringing and our equipment that we're bringing are mostly
Right.
pediatric, but do you want to just give that a shot and then just help? And sometimes that's just gathering enough information to sort of help us guide the process. I think the biggest thing is it's those partnerships that we're creating in these communities that we can plug them into something, right? And so in both in Guatemala and in El Salvador, we have created partnerships with folks that are there, that are, nonprofits or organizations that are working there. And they're not pediatric organizations. They're doing education or, religion, or what they're working in communities in other ways. And so generally we can use that connection and say, this gentleman needs help. Can you, that kind of a thing. And so that's we
Yeah.
just we just try to go in with a very honest approach and not try to operate outside of our scope, because I think there's some danger in that. And I think, for better or worse, those patients are coming in with a level of trust right off the bat. And
Right.
what you don't want to, they're the American doctors, they probably know. And then me saying something that may not be accurate, they would take that to heart. And so that's not the right way to go. The right way to go is to say, I actually don't know exactly what to do, but here's a contact. Here's someone who can reach out to you next week. Here's,
Yeah.
whatever the case may be, so that we can get you the help you need.
Yeah. I think there's a line that you don't want to cross there. So in terms of wins and just things that you've seen over the past 5 years, do you have any stories of like kids that have just made it, you know?
Yeah. Yeah. So I have two or three that come right to mind, and at very different levels, right? So one that comes to mind right away. So we started, after being in these communities for a couple of years and really starting to learn them well. What specific barriers do they face? What are their realities looking like, on the ground, and having those discussions and kind of building that trust. I think the next stage of our work is to start building some programs that ultimately can live on beyond Extra Mile being here, and those kind of things.
Yeah.
And so one example of that is we started a vision program with the help of a local eye doctor here in our hometown in the States. We developed a program with using some technology. We have a digital auto refractor, some Snellen eye charts, and we sort of created a protocol for where we're screening visions. There's always some risk to doing something like that, because you want to be able to act if you find, that there's a problem.
Right.
And so
Right.
along with that, we built a process for providing vision correction if we find children that need it, right? So with glasses or whatever the case may be. And so we developed that process. And to make a long story short, there's a kiddo who he's about 9 years old, and he's in a community called La Presa in El Salvador. And we saw him a couple of trips back. And when I was there in April, his mom came up to me and gave me this big hug. And she was super, I actually did not recognize mom at all. And she was like, I just have to tell you how grateful I am. I couldn't make it last time to your clinic because I was working, but I sent my son with our neighbor. And that's a very common thing. These folks live in community so well and they support each
Yeah.
other. So a neighbor had brought this little boy, and she said, and you guys gave him glasses last time. And he was struggling so much in school. He was getting headaches. He was just like really getting frustrated by school, all of those things. And now he loves school. He's having such a great time, all of these things. And she's just like, I can't thank you enough. And I sort of, my thing on that is, again, in the realities these patients face, if there's a kid who's struggling with vision, things are a little blurry, they're having headaches often, they're
Yeah.
getting frustrated at school. The answer isn't, well, let's go to the doctor, because that's a huge deal. It takes a ton of resources. They've got to go find, I mean,
Right.
that's not just going to the public clinic. That's sort of where can we find the eye doctor? And then can we get the glasses? And that is such an overwhelming hill to climb.
And how much is the glasses
And
going
how
to
much is it going
cost
to,
and
all of
that?
those, that's such an overwhelming hill to climb. They're not going to do it. And it's not because they don't want to, it's because they sort of can get by without it. And so this kid ends up grinding, right? They're
Right.
going to school, being frustrated, sometimes maybe even stopping going to school. They're dealing with headaches, all of those kind of things. And so it's a super simple, it's low hanging fruit. It's a simple fix, right? And it's not actually even all that costly at the end of the day to an organization like us to do that, but it's so impactful. This kid's trajectory, again, going to that sustainable impact kind of thing, if he's going to school and actually enjoying it and staying engaged longer, think about what that does for his future, right? It's unbelievable.
Right.
And so that stands out because it just fits our model so well. Those kinds of programs and those kinds of things are exactly what we want to create. So on one side of things, that's an example that comes right to mind because it's a simple fix and it makes a huge difference. On the flip side, there's one other one that I want to share from July. We have a patient that we met, I think, July of 2022 in Guatemala. And he was a patient that came in at literally as we were packing up to leave the clinic site for the day. It was 5 o'clock or 5:30. And this patient, mom carries him in. He's about 4 years old, 5 years old. She carries him in, and he has, pretty much right away you look and he has cerebral palsy, right? So he's got some physical limitations and he's nonverbal and all those things. But our team, we had 2 nurses with us on that team who that was their niche, right? They were nurses very experienced in that sort of complex care world. They had worked a lot with patients that had more physical needs and all those kind of things. And they rolled out a yoga mat while we were cleaning up clinic. They rolled out a yoga mat and were just working with mom and working with the patient. And they came up to me, both of them came up to me sort of as we were finishing, and they said, this kid, I think his strength and his mobility, I think he could actually really benefit if we could get him some supplies. Like he's a kiddo who could potentially, with the right braces or with, a walker, maybe, this is the kind of kiddo at home who would be getting physical therapy, all the time and be working with physical medicine and rehab doctors and all of those kind of things. And over time, potentially really progressing from a mobility standpoint and all those kind of things, and reducing the burden on mom, right? Mom's carrying this child everywhere and he's continuing to get bigger. And so those nurses said, we really could, this is a patient that could really benefit if we can do this, that, and the other. And one of them in particular kind of just, and she's been super, super supportive and involved and just a pivotal part of Extra Mile Pediatrics. Her name is Kayla. She went and sort of, once we got back to the States, obtained a bunch of different options, right? As far as some braces for him, some shoes that were big enough that would fit over the braces. She got a walker, all of those kind of things. We kept in contact with mom through our program coordinator. He was calling down and checking on the family and saying, hey, when we're back in the area, we're going to bring some supplies, hang in there, we're whatever. Again, knowing that they just didn't have that there wasn't the alternative from a
Right.
realistic standpoint for this family. Well, just this past July, so maybe 2 months ago now, we were back in Guatemala, and Kayla and I drove down to this community and met mom at breakfast. Actually, we went to a restaurant and we started setting this kiddo up and with all the equipment, and she was so grateful, and it was an amazing thing. He didn't really love it in that moment. He was like, "What is all this stuff
Yeah.
you're giving me and putting on me?" But so, we just had a nice time with them and then we left. Well, mom, who has our WhatsApp number, literally 2 days later, we're still in Guatemala. We're just in a different community. She sends us a video, and this kiddo is literally walking across a stretch right outside his home with this walker completely independently. Mom not, and the mom is just like beside herself because she's had to carry this child everywhere, right? Like he can crawl and he can, but this was him just motoring 2 days after we had
Okay.
brought him this walker, and then and then not maybe, I don't know, 3 or 4 days after that, she sends us another video. Now he's walking without the walker with the braces on. I kid you not. It was unbelievable. And it's just in a week span. And really, you know, again, it's kind of low hanging fruit. It was just a matter of getting him those resources. It was, he was doing it and mom's doing all the work, right? We just sort of accessed the supplies, had a little bit of basic understanding of what kinds of supplies might fit him best, and then just connected the two dots. And that, I mean, that part's difficult, frankly. And, that's the connection. And, how do you pay for getting it into the country? How do you get it
Yeah.
down to them? How do you, all of those kind of things. Those are all, you have to do the work there, but we're already doing that work. We're there. And I just think that follow up and that kind of resource building and all that. And it just was one of those moments that, it brings tears to your eyes to watch this kiddo who, had a certain set of circumstances now be free to be,
Yeah.
it's an unbelievable situation, and it's incredibly gratifying, but at the same time, it's kind of frustrating, right? Because you go, that
It was
that
just, you
shouldn't
just
happen.
needed that.
Exactly. That
Yeah.
shouldn't happen, right? And that's where I think you said, the question you started with wins, but that's also kind of, one of the things, I wouldn't call it a loss, but one of the things that just tugs all the time in this line of work is the equity, right? And just
Yeah.
the where you're born and the circumstances you're born into determining your access to that kind of care. Yeah.
Exactly. No, that's exactly right. I mean, somebody else was telling me he also has a nonprofit, works in Honduras, and he uses the phrase, people who are in like good areas in the United States and the UK and higher developed countries, they've kind of won the lottery for where they were born. And you just never know, because
Yep.
obviously I could have been born into a poor situation in India,
Yep.
who who
Yeah.
makes that
Yeah.
decision? You just
Exactly.
don't know.
Exactly.
So
And it's just being
yeah.
aware that those realities are unbelievably different, right? Just that awareness is huge. I think my youngest, but my daughters are teenagers now. I have a 14-year-old and an almost 18-year-old, and they've both gone on these trips with us on a couple of different occasions, which I love because early on in life, much earlier than I did, they're being exposed to sort of that difference. But I remember, one of the trips that my youngest daughter was on, we had a patient who, she actually lives in the house. We use a courtyard for this clinic in this particular community, and this little girl lives in one of the houses, and she is a sweet, super bright little girl, but she has some facial asymmetry, and she's got, a little bit from just from physical appearance look. She's got some situation there with asymmetry, particularly facial and head. And we were talking about the condition, of like a craniosynostosis situation,
Mhm.
which is not a terribly uncommon thing for us to see, but it's a correctable issue. You just have to catch it early, right? It's one of those
Right.
things where if that's not addressed, before the child's 6 months, 9 months, 12 months old, you kind of missed your window and those kind of things. And so we happen to have a little boy here in the States that we see all of the time that our family's incredibly close to, that was born with the same exact or developed very shortly after birth, the same exact condition, but had access to care and was fixed. And, you literally would never know that this child had that condition here, and then a child with that exact same. And I remember when I explained, we got home from clinic that day and my daughter said, well, tell me about that girl. And I said, I think she has the same condition or had the same condition, so and so had. And she just was able to, or she wasn't able to access the care. And I just, that moment of her seeing the discrepancy and seeing just the realities of
You saw the kind of
where
the
those
light
two,
bulb
yeah,
kind of go
exactly,
off.
where
Yeah.
those two children were born determined that whole thing. And that's just like, that tugs, right? That's the hard part about this work. But you get to know her, and she is an amazing girl. And so she has a ton going on, and we always enjoy seeing her every time we come to clinic.
Wow. Well, Jeff, thank you so much for coming on to the podcast. This has been such a great conversation. I do want to ask you maybe 1.5 questions. The last question I want to ask you is just like, what are you just most excited about in like the near future, 1 to 2 years down the line? And then the last question is just, how can people find you? How can people connect with you? And, if there are anybody in the pediatric world out there who are listening to the podcast who want to come out, even if you're not in the pediatric world, who wants to come and volunteer with Extra Mile, how can they find you?
Yeah. Well, taking the first question first, what I'm really excited about is that now that we, at least in the communities that we've already established a relationship with, and I do anticipate us growing into new communities, but especially in those locations that we're already have been working now for several years, I think we're now entering a stage where, like I mentioned earlier, building those programs that really are, you know, there's got to be an exit strategy here, right? Us being the
Oh
primary
my gosh,
care
yeah.
doctors for these children in perpetuity is not great medicine. It's not
Yeah.
great service work. It's just, that's not the right solution. And so we try to view all of these relationships as a, 10-year or 12-year relationship. It's get in there, learn the community, earn the trust, develop those relationships. And then the following couple of
Build
years,
their
what
systems
can we
up.
build, right? What can we connect to the spot? So that can be things like the vision program that's very easily, passed on. You can train, you can sort of develop, and you can leave a very intact and sustainable kind of thing that's going to work. And so
Right.
that's just one small example, but we're entering that phase. And that's, to me, super fun because there's a lot of thinking outside the box. How can we do this? We're starting to make connections with local physicians, local nurses, local dentists to say, like, how can we bring you guys into the fold with these communities that are so amazing, so that once we are ready to make that exit, we know that we're leaving them in a better place with
Yeah.
a system, right, that works. And so we're entering that phase, and that's what I'm most excited about, because I think that you always have to have your eye on long-term sustainable. And
Yeah.
that's, we've now spent that handful of years on the front end to put ourselves in a position where we can do that. And we have partners that I think are so pivotal in that. I just can't thank enough, as far as in country partners and folks that are working with us are just unbelievable on that front. So I'm excited about that, and that's directly tied into our ability to grow into more communities. Once we have those, or starting to build those systems that can then live on, we are freed up to then start to look and say, okay, where else can we go and where else can we set this up? So growth, but that's specifically, when I say growth, that's the way I want to grow. Um, and then how folks can find us. We are at Extra Mile Pediatrics, all written out, and pretty much everywhere you can find us. So our website is extramilepediatrics.com. We have a fairly active Instagram account that's also just Extra Mile Pediatrics, and folks can connect there. You can see a little more information about the places we go. We have a very simple online application process that if you want to go on a trip, we try to have our dates for our upcoming trips out for at least about a year in advance, because this takes some planning and takes some doing. So you can
Right.
find us there. If you are in a place where you want to jump on board and help and just get in this with us, then you don't have to be, as you mentioned, you don't have to be medical. We do take some non-medical volunteers on every trip. Certainly, we're always looking for docs, nurse practitioners, physician's assistants, nurses, all the above to come with us. And so if you do have a skill set in primary care, like pediatrics, family medicine, and want to do this, we would love to connect with you, because staffing, at least 4 trips a year with at least 4 providers per trip and all that, we need the pool to be big. So, and then if you're not in a place where going is in the cards right now, you can support us financially and just know that money is going to these types of programs and that kind of sustainable change. And, this game is all about resources, and it's about serving folks that don't have them. And it's about us having the resources we need to do that really effectively. So either or both ways that folks want to support would be unbelievably welcome. And we are always humbled by the folks that support us. And so, yeah.
Amazing. Thank you so much for coming on.
Yeah, thanks for having me. This is super fun, and I can't wait to show you in person what we do.
Yay! A lot of people that I interview and stuff, like I've developed such good relationships with them, and I've never met them in person.
Yeah.
So I'm so excited to see you in person.
Absolutely.
Thank you for listening to this episode. If you'd like to learn more about today's topic and guest, head over to the show notes linked in the description of this episode. There, you can get access to resources, links, and ways you can get involved in the pursuit for global health. And if you loved this episode, don't forget to write me a review on Apple Podcasts and rate the podcast on Spotify. It helps me get in front of more people just like you and continues to elevate the causes we are so passionate about. I'll see you in the next one.